I'm John Strum, and this is Real Talk MS. It's June 16th, and we have a lot to talk about. And one of the subjects that people affected by MS love talking about are the non-pharmacologic treatments that help manage MS. Disease-modifying therapies are sort of a given. They're going to be helpful in managing symptoms and, maybe most importantly, slowing MS progression. But when we talk about non-pharmacologic treatments, we're talking about alternative medicine, complementary medicine. We're talking about over-the-counter supplements and lifestyle options like diet and exercise. And I think one of the reasons that people like to talk about these things is that they're things that fall under our control. And I think there's some comfort taken when someone feels as if something they can decide to do can have a direct impact on their health, on their quality of life, on their overall well-being. Integrative medicine is a medical practice that combines evidence-based alternative medicine with conventional medicine. And my guest today is Dr. Alan Bowling. Dr. Bowling is an internationally renowned neurologist, multiple sclerosis specialist, and an integrative medicine pioneer. He's currently the director of the NeuroHealth Institute, and Dr. Bowling is a clinical professor of neurology at the University of Colorado. When it comes to care and treatment for MS, Dr. Bowling has published over 100 articles in clinical and basic science journals. He's been involved in research related to nutrition, dietary supplements, and other non-pharmacologic therapies for the past 30 years. Dr. Bowling specializes in integrative medicine for MS. And in our conversation, we're going to cover CBD and other cannabis products as potential treatments for MS. We'll talk about diet and exercise, over-the-counter supplements, maintaining your emotional health, and lots more. But before we get to my conversation with Dr. Alan Bowling, there are a few other things that you should know about. In 2013, an international committee of distinguished experts published a paper that set out the specific terms to be used in describing the disease state that someone living with MS was experiencing. The paper defined 4 categories of MS: clinically isolated syndrome, and that describes an initial episode of neurological symptoms; relapsing remitting MS, secondary progressive MS, and primary progressive MS. The paper also recommended that additional terms should be used to describe a person's current disease state. Terms such as active, which is shown by relapse or changes on a patient's MRI, and progression, which is shown by the worsening of disability independent of relapse activity. And while there was no specific time period specified for the activity, it was recommended that an assessment was performed annually. However, since this paper was published 7 years ago, regulatory agencies, that is the U.S. Food and Drug Administration and the European Medicines Agency, well, they've created some serious confusion about how these terms are and aren't being used. In fact, these two agencies have each defined some of the same terminology differently. And that creates obstacles to patients having access to certain disease-modifying therapy, having your health insurance approve certain disease-modifying therapy, and this confusion even creates added difficulty in recruiting for clinical trials, which creates additional obstacles to future treatments. So for all these reasons, this confusion required clarification. And so the International Advisory Committee on Clinical Trials in Multiple Sclerosis, which is jointly supported by the National MS Society and the European Committee for Treatment and Research in Multiple Sclerosis, has published a new clarification of the terms that should be used in describing and categorizing multiple sclerosis. The new clarification statement reiterates the definition of activity as clinical relapses or imaging features of inflammatory activity evaluated annually or over another specified time interval. The definition of progression is reiterated as clinical evidence of disability worsening independent of relapses in individuals in a progressive phase, evaluated annually or over another time interval. And the term worsening was defined as an increase in impairment or disability as a result of residual deficits caused by relapses or increasing disability during progressive phases of MS. The subtle but perhaps most important aspect of these definitions is the reminder that the disease states are observed and assessed annually or at least within a specific time frame. And the reason that's so important is because in approving some of the newer disease-modifying therapies, specifically Okravus, Mayzent, and Mavenclad, both the FDA and the EMA referenced that these disease-modifying therapies were approved for active secondary progressive MS, but they failed to include any time parameters for what they meant by active. And one obvious loophole or bit of confusion here is that at some point, every single person with secondary progressive had active MS, right? So if you're going to limit access to a specific medication based upon evidence of active disease, you need to explain what that means. And this clarification of terms underscores the importance of including a time frame in categorizing someone's current disease state. So this isn't a theoretical issue. It's one that hopefully helps scientists recruit people with a clearly defined disease state for future clinical trials. It helps us understand that clinical trial outcomes are related or reflective of a group of participants with a clearly defined disease state, and that's the same definition that's going to be used by regulatory agencies like the FDA and EMA in granting approval and clarifying who should have access to a specific medication. If you'd like to review this statement of clarification, I'll include a link in today's show notes. And if you've already downloaded the free Real Talk MS app from the Apple App Store or the Google Play Store, you've already received a PDF of this statement of clarification, and you'll find it under the bonus content tab. By now, I hope you've discovered the Ask an MS Expert weekly webinar series that I moderate for the National MS Society every Friday at 1 p.m. Eastern Time on Facebook Live and YouTube Live. After 14 weekly episodes, we've fielded hundreds of questions from the audience, and I've received at least 100 additional emails with questions about COVID-19 and MS. And the single most asked question is, does Okravus make me more susceptible to COVID-19? And if I do get diagnosed with COVID-19, will I have a more severe case? So first, let me explain why some people ask that question. Okravus is, of course, a very popular MS disease-modifying therapy. So far, it's the only disease-modifying therapy that's been approved to treat primary progressive MS. Worldwide, over 160,000 people with MS have been treated with Okravus, and Okravus is what's referred to as a B-cell depleting therapy. In other words, Okravus works by eliminating a certain category of cells in our immune system that have a certain protein on their surface. And by depleting some of these specific B cells, it's believed that Okravus limits the inflammatory activity that attacks myelin. However, by depleting some of these cells, Okravus may also weaken a person's immune system, leaving them more susceptible to infection. And that greater susceptibility to infection is what worries a lot of people getting Okravus infusions to manage their MS. So far, researchers and frontline healthcare providers haven't seen any evidence that would indicate that people on Okravus are more likely to contract COVID-19 or have a more severe disease course if they do. But as you can imagine, there isn't a lot of research available yet because healthcare providers are discovering things about COVID-19 in real time. So a couple of weeks ago, a research team from Roche, the pharmaceutical company that manufactures Okravus, examined the patient data that had been submitted to the Roche Genentech Global Safety databases. And while the data isn't robust, the conclusion appears to be the same. Quoting from their report, "Based on the limited data available to date, there is no evidence at this time to suggest a more severe course of COVID-19 in ocrelizumab-treated people with MS. Of course, we'll update you as new information becomes available, and if you'd like to look at Roche's analysis of the data, I'll include a link to their report in today's show notes." If you're a regular listener, then you've heard me talk about depression and MS, and I tend to talk about it a lot because I've seen firsthand how depression can keep someone from engaging in life. It gets in the way of everything, and everything can include your relationships, your health care, your state of mind and well-being. Left untreated, depression can impact every area of life, and it makes all those areas of life somewhere between a little bit and a lot worse. Research has shown that about half of everyone living with MS will be diagnosed with depression. So I consider depression one of those MS symptoms that can have a significant impact on many other symptoms. And now a new study has shown that depression doesn't only make your MS symptoms feel worse, it actually makes your MS worse. And that bears repeating. MS patients with more severe depression show greater worsening in neurological function, relapses, and MRI lesion activity over 12 months compared with their less depressed counterparts. The observational study was conducted by a team from the Cleveland Clinic, and they looked at data from just over 2,500 MS patients from 10 different MS centers. Demographic and clinical data, MRI metrics, neuroperformance test scores, and patient-reported outcomes were obtained at the beginning of the study and then at a routine 12-month follow-up. The analysis of the data showed that when compared with less depressed MS patients, patients with more severe depression at the beginning of the study had worse cognitive processing speed, slower walking speed, and were more likely to have gained a new contrast-enhancing lesion. Further, the study showed that even as more severely depressed patients' functional performance diminished over this 12-month period, the patients themselves didn't recognize the decline. The important takeaway from this study is that depression contributes to a person's MS disease course. It's not just a reactive phenomenon. So acknowledging the long-term effects of MS on disease progression and initiating appropriate screening for depression and treatment for depression is a necessary aspect of optimizing MS treatment. So if your neurologist isn't initiating a conversation with you about your emotional well-being, it's up to you to initiate that conversation. There may not be a cure for MS today, but please remember that today, depression is something that can be successfully treated. And often when we talk about depression, we can actually mean anxiety. Living with the uncertainty and unpredictability of MS can lead to high levels of stress and anxiety. And because anxiety disorders can be overshadowed by depression, anxiety is often overlooked and also undertreated. So Dr. Lauren Strober, a past guest on the podcast and a senior research scientist and staff neuropsychologist at the Kessler Foundation, and her research partner, Mariam Hanna at Montclair State University, looked at how depression and anxiety impacted the quality of life among people living with MS. In their study, the researchers looked at 183 people living with MS. The study participants completed a comprehensive online survey designed to assess depression and anxiety, along with demographic information and disease risk factors like levels of social support or substance abuse. The study participants also completed questionnaires that measured their MS symptoms, disease management, psychological well-being, and their quality of life. And the results of the study indicated that, as you'd expect, depression and anxiety were both common among people living with MS. However, what was interesting is that with few exceptions, anxiety proved to be more impactful than depression in determining psychological well-being and quality of life. And when it comes to predictors of anxiety and depression, the level of social support was a consistent predictor. Younger age and shorter disease duration were also associated with anxiety, while lower education and substance use were predictors of depression. The researchers concluded that the same attention that's being given to depression should be given to anxiety, as anxiety actually plays a significant role in an individual's perceived health and well-being, and subsequently impacts the severity of MS symptoms and their overall quality of life. Early identification of anxiety and potential substance use and increased social support were identified as being crucial for mitigating the impact of depression and anxiety. And if you'd like to review this study, you'll find a link in today's show notes. And while we're talking about anxiety and depression, I want to let you know that there's a new app for that. Well, maybe not quite an app, but a web-based self-help tool that's been developed by the MS Trust in the UK and the pharmaceutical company Biogen, along with people living with MS, a team of MS specialist nurses, and an MS clinical psychologist. The self-help tool is called Act Myself, and it's based upon a form of psychological therapy called acceptance and commitment therapy, and that's where the ACT comes from in Act Myself. Acceptance and commitment therapy, or ACT, uses some of the same principles as mindfulness and cognitive behavioral therapy, but instead of trying to help you to alter your thoughts and feelings, ACT encourages you to become more aware of your thoughts and feelings and the helpful and unhelpful ways you respond to them. It tries to help you discover what matters most to you, and then helps you find ways to do those things. Act Myself came about after the MS Trust conducted a survey that found the majority of people living with MS struggle with emotional well-being after MS becomes a part of their lives, and that nearly 3/4 of the survey respondents indicated that they felt anxious or depressed more than several days each month. Yet 78% of them were never offered any kind of mental health support to deal with their emotions. It seemed that as the COVID-19 pandemic generated increased levels of fear, anxiety, and depression across the general population, it became even more important that issues of emotional well-being were properly addressed among people living with MS. Act Myself uses a series of interactive exercises, each lasting no more than 5 minutes, to help patients learn to live more in the present and to focus on the things that are most important to them, despite the various stresses that they may be facing. And the final part of the interactive tool actually offers an ACT plan that's been tailored to the individual patient based upon the answers that they've submitted in all of those exercises. Now, if you'd like to get started with Act Myself, or just check it out and give it a test drive, it's free to use, and you'll find a link in today's show notes. Treating your emotional wellness is just one aspect of total MS care. And by including evidence-based complementary medicine treatments, an integrative medicine specialist can take advantage of a very large toolbox to treat multiple sclerosis. My guest today is Dr. Alan Bowling, an internationally renowned neurologist, speaker, author, and integrative medicine pioneer who has specialized in treating MS patients for the past 3 decades. In a moment, we'll hear my conversation with Dr. Alan Bowling. My guest today is Dr. Alan Bowling. Dr. Bowling is an internationally renowned neurologist, multiple sclerosis specialist, and integrative medicine pioneer. He has a passion for providing care to those who are living with MS, and Dr. Bowling is currently the director of the NeuroHealth Institute, and he's a clinical professor of neurology at the University of Colorado. When it comes to care and treatment for MS, Dr. Bowling has published over 100 articles in clinical and basic science journals. He's been involved in research related to nutrition, dietary supplements, and other non-pharmacologic therapies for the past 30 years. And he's authored 5 books, including Optimal Health with Multiple Sclerosis, a guide to integrating lifestyle, alternative, and conventional medicine. Welcome to the podcast, Dr. Bowling.
Great. Thanks for inviting me to be here.
I'm hoping you can get us started by explaining what integrative medicine is and what got you interested in specializing in integrative medicine for MS.
So the second part of the question, sort of what got me interested, it's sort of the backstory to my career. So I grew up in Colorado in the 1960s, 1970s, and back then, people were very interested in healthy lifestyle, and they were interested in marijuana, and they were doing also some unusual alternative therapies and herbs, and a few people were doing yoga even back then. And then after high school, I left for 20 years to get a very formal college and medical school education and a PhD in pharmacology, and I did a 3-year fellowship after all my neurology training, and then I came back home, and I was humbled within a few weeks because I thought I'd arrived with every toolbox I could have to treat the patients I saw. And what happened was, I should have anticipated this, but people were asking me about unconventional therapies, and they were asking me about lifestyle and how that could help treat their disease or not. And I had no answers to the questions because I'd actually gotten zero training in all of that. But I used the academic rigor that I'd gotten through my training to start answering those questions. And when I did that, I realized some of these questions people were asking me about for therapies, some could kill them and some could be really helpful and should be the standard of care. So that became the career focus for me, to use academic rigor to address lifestyle and unconventional therapies in MS. And then the bigger question is, how do you put those therapies together with conventional medicine in a safe and effective way, and how do you individualize it for each person? So that's what I write and lecture on. And then my clinic, that's where a lot of the ideas come out, or that's where I put all of this, all these approaches into practice. And then in terms of integrative medicine, in terms of what that is, there's a lot of misuse of that term. The correct term, and it's very clearly defined, is that it's the blending of conventional with unconventional approaches, and also with lifestyle. So it's conventional medicine, unconventional medicine, and lifestyle blended together. It ends up being very individualized because there's not a formulaic way to do this with MS. And then also importantly, 2 other important factors. One is its attention is paid to treating disease, but also to preventing disease. And it's focused on the whole body, not just, in the case of MS, for example, not just the nervous system and the immune system, but really kind of thinking of a whole body approach.
You know, when you Google integrative medicine, you come across a lot of different terms like alternative, complementary, integrative medicine, and then integrative health. Do all these terms tend to mean the same thing, or are there differences between them?
Yeah, they're actually quite different. And you could write a whole book on all the different terms that are used in this area. And then, sometimes, like I say, sometimes they're used very appropriately and sometimes not so much. So the term alternative, the technical definition of that is it's an unconventional therapy, so therapy not typically taught in medical school or offered in hospitals or clinics. So it's something that's unconventional, it's used instead of conventional medicine. So if someone uses acupuncture for their MS and they don't use any conventional medicine, then the acupuncture is alternative. Complementary means all those unconventional therapies that I just described used alongside conventional medicine. So if someone uses acupuncture for their MS, but they use a conventional medicine as well, then the acupuncture is complementary. And then integrative medicine, I already kind of talked about that kind of blending of conventional, unconventional, and lifestyle. Integrative health often refers to just the maintaining health through an integrative approach, sort of that health prevention aspect of integrative care.
So, as an integrative medicine specialist who specializes in providing care for people living with MS, how would you characterize the difference between the way that you would approach treating MS compared with a neurologist whose sole focus may be on, I guess, what I'll call traditional Western medicine practices, the stuff that they only learn in medical school?
Yeah, there's actually a fundamental difference. It just feels like a totally different approach to providing care. And I've done both. So I certainly got trained in the very conventional model, and then integrative care. It isn't just sort of adding a few elements onto the whole conventional care model. It really is a whole different mindset. So you're thinking and you're doing all the rigorous conventional medicine approaches in my clinic, and we do clinical trials, and we do everything you do at a very high level within conventional medicine, but you're blending these other factors in, not just handing people sheets of information, but you're really building that into the day-to-day treatment plan, and you're thinking more broadly, not, like I said, not just about MS and not just about the nervous system and the immune system, but you're thinking about the whole body, and you're not thinking just about disease, but you're thinking about maintaining health. And I think a specific kind of concrete example of how this plays out in clinic that feels different than I think often conventional medical care for MS is a younger person in their 20s or 30s who's diagnosed with MS. An integrative approach is to do all the conventional medicine, but then get into especially the lifestyle factors like physical activity, diet, emotional health, tobacco, alcohol, and then using those factors to keep the rest of the body healthy. And I think, and I've seen this hundreds and hundreds of times over my career, that an MS diagnosis, not immediately, but after a year or two, it can be a huge motivator for people to live a healthier life than they would have otherwise. Because people start thinking at a young age, oh my gosh, I have MS. What aspect of this can I control? How can I do something to take care of my body, take care of myself? So, like I said, it doesn't happen the first few months after diagnosis, but that comes over time. And then with an integrative medicine approach, that's a huge opportunity. And I think it might be an opportunity that's missed if you just take a purely conventional medicine approach. And the opportunity for the integrative approach is that you use the kind of bad news diagnosis of MS as a motivator to produce lifestyle change at an early age when most people have no other medical conditions. And if you do that at that age and people keep doing the healthy lifestyle approaches, there's going to be a good chance those people will have far fewer lifestyle-induced diseases than they would have otherwise, like obesity and high blood pressure and diabetes and high cholesterol. And I've seen that. I've been doing this for 25 years, and so I've seen that play out. So people I've followed for 20-plus years, for example, they get into their 60s, and I have several of those people who come in now and they say, it's the weirdest thing. I'm in my 60s and I'm the healthiest 60-year-old I know, and have had MS for 20 years. And it's because they, unlike friends and family at a young age, 20, 30, 40, they really paid attention to lifestyle factors, and they wouldn't have done that without the MS. And then all that kind of emerges from us working together over 20 years, clinician with person with MS, kind of working together. And if they're kind of slip off with something, I'm there to be with them and kind of get them back on track with whatever lifestyle factors have faltered over time.
When people affected by MS think about alternative or complementary medicine, the conversation often gets around to the use of CBD or cannabis itself. There seems to be an awful lot of opinions on the subject, but what do we actually know about cannabis and MS? And what should people living with MS be thinking about when they're considering self-medicating with CBD or cannabis products?
Yeah, that's one of the hottest conversation topics nationally and in my office, in my state. And we've had medical marijuana for about 20 years in Colorado, and then the recreational for several years. So it's something that's certainly out there and very readily available. In terms of objective, and I liked how you started the question. Sometimes there's, I think, even health professionals and the lay public, I think often there's strong opinions, but sometimes people don't have all the evidence. So it's unique in that way. To me, it's sort of the quintessential unconventional medicine topic because it kind of gets into opinion versus evidence and legal boundaries and ethical boundaries. So in terms of the objective evidence, so there are nearly 20 world-class studies, and I've reviewed these in publications. These studies in MS showing benefit for people with MS with pain, spasticity, a little less good evidence, but still evidence for helping with bladder issues and also sleep. So that's what the objective evidence shows. What I find in clinical practice is people with pain and or spasticity that interferes with sleep or kind of breaks through in the afternoon, a little bit of cannabis can help those people significantly. The challenge in this area is it's called a lack of fidelity between sort of what the clinical research has shown and then what we can do in practice. So there's not fidelity between these clinical trials and practice because the trials have been done with research-grade preparations of cannabis that you can't buy at any dispensary in the U.S. So it's a challenge to know how to duplicate what was seen in the clinical trials with dispensary products. Also, I think in this area, unfortunately, and I'm not quite sure how this has happened, but it's a unique territory in that, like with any medication, cannabis has potential benefits, like I mentioned, but it has potential side effects and drug interactions. And those side effects and drug interactions are well described in the medical literature, but there really isn't a proactive way that I've seen that states are educating the public and requiring education of health professionals to know the effectiveness literature and also the safety and drug interaction literature. So there are multiple side effects, and this has actually been studied formally in various healthcare professionals, including physicians and also in people who use cannabis. And just it's stunning the lack of knowledge of basic aspects of cannabis, including whether it's addictive. 50% of people who use cannabis don't think it's addictive. 50% think it can work for depression and anxiety, which there's not evidence for that. 70% think it does not interfere with driving. That's people who use. And then similarly, health professionals, there's more than 20 studies now showing kind of a stunning lack of knowledge about cannabis among health professionals. And these are the ones who are for medical marijuana for people with MS. These are the ones who are signing off on saying that cannabis could be helpful. So, and then also cannabis products have variable quality. The staff who work at dispensaries generally have no medical or scientific training in my state. There was a recent study showing 20% of the staff get high or they use marijuana going to work, at work, and or going home from work. So that's concerning about cognitive dysfunction among the staff who were actually recommending and dispensing products to people with MS. So I don't get into whether it should be legal or not, pro or con, but I'm definitely pro-informed decision making. And that seems really important. And I do that with any MS drug. We spend significant time going through the benefits, but I list the side effects. I tell people, I don't want you to decide on this MS medicine sitting here. I want you to take this information. I give them very detailed information about the good and the bad of any drug and have them call back in a week if they want to start the medication. And I think that exact approach needs to happen, and it's not happening with cannabis. And when I do that in my office, so I take on that role. So I do that with my patients, and I've got detailed information I share with them. And some of them look at the information I provide, and they say, I didn't know this. Thank you for sharing this. I'm not going to pursue this until we have more regulated products, or I can be more confident about what's in this. And others look at the information. They've already tried it, and they say, my quality of life has improved so much with this that I'm good with these risks and these unknowns. But they've actively participated in that informed decision making. I think that needs to happen more.
I think you're right. We have so many people who hear a snippet of a conversation based on someone's opinion on someone else's opinion that they can easily move forward with an idea or their own treatment plan, their own self-medication plan, without really understanding what the facts are, not having the opportunity to make that informed decision. And, it's not limited to cannabis products. When the COVID-19 pandemic began, the internet echo chamber was just full of chatter that people living with MS should immediately start taking supplements that promise to strengthen your immune system. But over-the-counter supplements, even though they don't necessarily require prescriptions, they can still have dangerous interactions with other medications, and they can carry their own set of side effects. So what's the safe and sane way for someone to broaden their MS treatment to include complementary or alternative medicines?
So I often think of MS treatment in terms of kind of a conventional approach, which is disease-modifying therapies, using drugs to treat the symptoms. And then I think of 5 other broad categories that often are not part of the standard of care of MS. So I think about physical activity. And with that, I think of 3 to 4 days a week of exercise, 30 to 60 minutes per session, having that include stretching and balance, and then also during or at the end to just relax. Lots of relaxation molecules produced by exercise. So that's the physical activity piece. The diet piece, I think diet often gets simplified to what supplements someone should take, and that really that's kind of a false approach to nutrition, especially as it relates to food. Food is very complex, contains thousands of molecules, and so to think you could duplicate the health effect of a complex food by taking out one molecule, purifying it, and giving it in gigantic doses, that's it's a little odd that we thought about that so seriously for so many years. The trend now is more away from that and more thinking about the whole food approach. But for people with MS, particular nutrients I'd think about would be vitamin D and vitamin B12. You can check levels. If needed, you can supplement and recheck levels. But the focus should be really more on food. The food general approach is Michael Pollan's quotation, real food, not too much, mostly plants. My modification of his quotation is real food, not too much, mostly plants. Enjoy. I see people who come in who have thought with their MS they've got to be following this very strict diet, and there are people who love food and they do not like the diet they're on, and that's unfair that they think they need to follow something that's taken away the joy of food for them when there's really not evidence to support that over a diet that would have lots of foods that they would enjoy. So I think you really have to be mindful of that. Another aspect of the diet piece is weight management that could impact disease course and certainly can help with multiple MS symptoms. Third area is emotional health, depression, anxiety. Those are the obvious approaches, but kind of emotional literacy. Are you able to read your emotions in real time and respond to them? If you can do that, then the risk for depression and anxiety goes way down, because often depression and anxiety come up because people are not identifying and processing emotions in real time. And I think we often just focus on the negative, like depressed. Are you depressed or anxious? Well, if you aren't, then you're emotionally healthy, but you should be able to experience and enjoy positive emotions. So it's kind of working through the negative and enjoying the positive. Lots of ways to address that. The best unconventional non-pharmacologic treatment for depression is physical activity, but there are life situations that, like an MS diagnosis, that have led to depression or anxiety, then psychotherapy, counseling, that can be very helpful to actually work that through. If it's more severe, then medications can help. Fourth category is tobacco and alcohol, so no tobacco. Quite good evidence that has negative effects on MS. And then alcohol, there's no good evidence that abstinence is the best thing for MS, so alcohol in moderation. So roughly 1.5 to 2 drinks per day for men and 1 per day for women. And then the fifth area, which is the most important areas where we have the most evidence, is to keep the rest of the body healthy. And I already kind of indicated that, but the best way to keep the rest of the body healthy is to do those first 4 steps. Have a good physical activity program, a generally healthy diet, good emotional health. And that fifth area is so important because there's evidence that if you just get one other medical condition, that can negatively impact MS significantly. And many of the studies that have looked at these other medical conditions, the other medical conditions that can negatively impact MS are actually caused by an unhealthy lifestyle. So things like obesity and diabetes and high blood pressure and high cholesterol and heart disease, you say any one of those could worsen MS. And that list I just gave of those conditions, many of those, they're not just influenced by lifestyle. Some of them are actually caused by it. So a healthier lifestyle could treat those or prevent them.
Well, Dr. Alan Bowling, I want to thank you for all that you do to improve the quality of life for people living with MS. And thanks for talking with me today.
Well, great. Thanks so much for letting me be a part of your podcast.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting people know that all they have to do is point their web browser at realtalkms.com/146. That's realtalkms.com/146. And you'll find that link in today's show notes so you can easily copy and paste it right into an email or text. I don't think that I have to tell anyone listening to this podcast that the COVID-19 pandemic has intensified and in some cases multiplied the challenges of living with MS. From having difficulty affording MS medications to adjusting to increased isolation, to coping with the added uncertainty of wondering how you or your family might be personally affected by COVID-19. More than ever before, people living with MS need access to reliable information, support, and connection. We're witnessing that even during a pandemic, MS doesn't stop, and neither does the National MS Society. So they've established the National MS Society COVID-19 Response Fund to ensure that the Society can continue meeting the urgent and expanding needs of the MS community during these unprecedented times. During the pandemic, we've seen the MS Society create virtual programming and support groups literally on the fly so that no one has to face MS alone. They've created resources and provided information so that doctors and nurses can deliver the very best care. They've continued to amplify the voices of the MS movement to influence critical public policy decisions, and they've never stopped advancing research to find cures for MS. I know that these are financially tough times for a lot of people, but I'm asking that as you're able, if you're able, please make a donation to support the National MS Society. To donate, you can text the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. Or if you prefer, I've created an online shortcut to get you to that same webpage. So you can just visit realtalkms.com/COVID-19 Response Fund and make your donation. You'll find that link in today's show notes. But however you choose to contribute, please contribute today. It's never been more important. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.